Hello everyone, I am Dr. Saroja, Consultant Obstetrician at Birthright Hospital, LB Nagar branch. Today we will discuss regarding the number of scans throughout pregnancy. So usually in our older days, our elder people used to tell us that first 3 months there is no need of scan at all, but it's not correct. Usually the first scan will be done around 7 to 8 weeks of pregnancy. This is just to know whether the pregnancy is inside the uterus or anywhere implanted outside the uterus. Sometimes there are very rare chances that pregnancy can happen even in the tubes, ovaries or in the abdomen. So just to rule out that and to see whether the fetal heart has started or not. For that we do first scan at around 7 to 8 weeks of pregnancy. If the patient is complaining of severe pain before this also, before 7 weeks also, sometimes we need to do the scan just to rule out the sac position, whether it is in the uterus or not. And the second scan will be done around 10 to 14 weeks. In between any time we can do, usually 12 to 13 weeks of gestation. We call it as NT scan, nuchal translucency scan. In NT scan we'll get to know the nuchal translucency, means the thickness of the fat on the back of the neck. By this we'll get to know any chances of chromosomal abnormality in the baby are there or not. Okay, and third scan will be done around 19 to 20 weeks of pregnancy. This is congenital, to rule out any congenital anomalies in the baby. Anomalous scan we call it, targeted imaging scan for fetal anomalies. So this is to rule out the anomalies in the baby and to see whether the placenta position is normal or is it low lying placenta or it is anterior position or posterior position, and to see the length of the cervix also, whether the cervix is short, whether there is any need of cervical cerclage also, all we will see in this scan. So after this scan, usually we don't have scan till up to 28 weeks. After 28 weeks, between 28 to 30 weeks, first growth scan will be done. If in TIFA scan any doubt is there in the heart structure, then some radiologists may advise you to go for fetal echo scan, that is the fetal heart scan, around 24 weeks of gestation. And first growth scan will be done between 28 to 30 weeks of gestation. In this we'll get to know about the liquor, what is the amount of liquor, whether it is excess liquor or less amount of liquor, how the baby's growth is going, and all that we'll know in this scan. After that, second growth scan will be done between 34 to 36 weeks of gestation, that is after 9th month started. So in this also we'll get to know about the growth of the baby only. So if there is any doubt only for some high risk cases or any twins patients, we'll advise a scan around 37 to 38 weeks to see whether there is any change, there are any changes in Dopplers, or whether the amount of liquor is decreasing or increasing. That we'll get to know with the AFI Doppler scan. If required only we'll do, otherwise second growth scan is enough at 36 weeks of gestation. Thank you.